Do you know that every year we diagnose 90,000 new lung cancer cases in our country? A significant majority of these patients present in advanced stages. And not surprisingly, we see 80,000 lung cancer cases dying every year. Hello, I'm Dr. Devavrat. I'm Director, Medical Oncology at Max Institute of Cancer Care, Saket, Delhi. Treating lung cancer in a clinic can be very challenging. One, most of the patients present with advanced stage. A lot of these patients are very old and frail. Significant number of these patients have been smokers in the past or they are currently smoking. And a large majority of these patients would harbor other diseases like diabetes, hypertension, weak lungs, weak heart, etc. The backbone of treatment for advanced lung cancer traditionally has been chemotherapy. What we also know is that chemo can be very difficult in majority of patients, but also in this frail subset of patients that I've just talked about. Chemo can give significant side effects. And technology has therefore focused on identifying more effective and safer treatments. One set of these therapies are called targeted therapies. These are mostly oral tablets, sometimes injectable treatment, which are known to more effectively control the cancer while they do not have any impact on the normal cell. So at one end, we see good effective control of the disease, and at the other end, we see minimal side effects. Research has shown that when identified, a lot of mutations can be targeted with these targeted therapies, and in those settings, targeted therapies lead to more effective control of the disease than chemotherapy. They lead to less side effects compared to chemotherapy. And now there's data to show that these patients who are able to receive targeted therapy live longer and with a better quality of life. In my many years of practice, especially when I deal with advanced lung cancer, there are some questions that I come across very frequently, either in my clinic or on the internet. Whether patients with advanced lung cancer can ever be cured with targeted therapy. Investigation and treatment of lung cancer has really advanced. The field has moved beyond a simple biopsy to higher-end tests like next-generation sequencing and comprehensive genomic profiling. These tests help us identify certain DNA defects that we refer to as mutations, some of which may be responsible for the growth of the disease, the growth of the cancer. These are what are targeted by the so-called targeted therapies. What we know from years of trials and research is that when patients harbor these targeting mutations, are treated with these targeted therapies, they not only live longer, they also have a better quality of life. The traditional treatment, that was chemotherapy, would lead to an average lifespan of only about 1.5 years. But with targeted therapy, we are increasingly seeing a significant number of patients who actually are able to live beyond 5 years, which means that lung cancer, which is actually an acute disease, is now being converted into a chronic disease like diabetes, like heart disease. In select number of patients, with the help of radiation and surgery, these patients who have derived benefit with targeted therapy may actually be cured. Question number 2. How effective are targeted therapies for lung cancer? In my experience, about 40% of patients with advanced lung cancer will be candidates for targeted therapy. Where used, we see that targeted therapies are able to reduce the disease in about 60 to 70% of cases. And in additional 20% cases, there will be disease stabilization. What we will also come to understand is that their ability to control the disease is much longer compared to chemotherapy. The serious adverse effects, that is side effects, that we see with target therapy are much lower compared to chemotherapy. And finally, the long-term outcomes, the overall survival certainly seem much longer with target therapy compared to chemotherapy. Another question is, do all patients with advanced lung cancer need chemotherapy? Chemotherapy has been the backbone of treatment for most cases of advanced lung cancer, but it is associated with its own problems. Reduced effectiveness, high number of side effects, and particularly for the population of patients who are old or who have other illnesses, doing chemotherapy can be very challenging. Nearly 40% of my patients with advanced lung cancer will have an identifiable gene defect called as a mutation where targeted therapy can be used. And for majority of these patients where there is an option of doing targeted therapy, chemotherapy in fact may be totally avoided. What we have seen is for that these patients, when chemotherapy does not need to be used, their ability to receive treatment with targeted therapy is much better than with chemotherapy, and the outcomes, including the quality of life, is way superior compared to chemotherapy when we see treatment with targeted therapy. The landscape of treatment of advanced lung cancer has changed dramatically. From chemotherapy being the backbone of treatment to newer agents like immunotherapy and targeted therapy, from a select number of patients being candidates for targeted therapy to a bigger population, as many as 40% patients being candidates for targeted therapy, from one targeted therapy to tens of different oral and injectable targeted therapy, the armamentarium of a doctor has increased. It means that the benefits get translated into a better quality of life and a longer survival. And therefore, treatment of advanced lung cancer has become much more successful with these new agents, including targeted therapy. I hope you found the information in this video useful. And if you have any suggestions, comments, or questions, please feel free to share them below.